Life is full of small moments we take for granted: the laughter of a loved one, the satisfaction of a good meal, the energy to chase our dreams. But sometimes, beneath the surface, our body starts to whisper, sending us signals we might overlook. These whispers are often the earliest signs of cancer, a silent threat that grows unnoticed until it's too late. Every year, millions of lives are lost to cancer, but many of those lives could have been saved if the disease had been detected early. The good news? Your body often tries to warn you, long before the danger becomes life-threatening. Today, we're uncovering 8 early warning signs of cancer that are backed by science and real-life stories. These signs could mean the difference between early treatment and late diagnosis, between life and loss. So, listen closely. This information might save your life or the life of someone you care about. Sign 1: unexplained weight loss. Weight loss can feel like an unintentional win, especially in today's health-conscious world. But what if you suddenly drop 10 or 15 pounds without changing your diet or exercise routine? That's not just unusual, it's alarming. Research shows that about 40% of people with cancer experience unexplained weight loss before their diagnosis. This symptom is particularly common in cancers of the pancreas, stomach, or esophagus. Cancer consumes a lot of your body's energy and disrupts its ability to absorb nutrients. In some cases, tumors release substances that cause your metabolism to accelerate, leading to rapid weight loss. Real-life stories highlight this sign. Many patients initially attribute the weight loss to stress or a busy lifestyle, only to discover it was an early symptom of cancer. If you notice a consistent weight drop of more than 5% of your body weight over 6 months without explanation, it's time to see a doctor. Regularly track your weight, especially if you're noticing other unexplained symptoms alongside it. Sign 2: persistent fatigue. Imagine waking up after a full night's sleep only to feel like you haven't rested at all. This is the reality of cancer-related fatigue. It's a deep, overwhelming exhaustion that no amount of rest seems to cure. This kind of fatigue is commonly associated with leukemia, colon cancer, or cancers that cause anemia. Fatigue occurs because cancer cells consume your body's energy, and your immune system works overtime to fight back. This can also cause inflammation, further draining your energy reserves. For example, many patients with blood cancers like leukemia report feeling unusually tired for weeks or months before seeking help. Keep a fatigue diary. Note how often you feel tired, how long it lasts, and what makes it better or worse. Persistent fatigue, especially when paired with other symptoms like weight loss or pain, should prompt a visit to your doctor. Sign 3: skin changes. Your skin can be a mirror of what's happening inside your body. A mole that changes color, grows larger, or becomes irregular could be a sign of melanoma, one of the most aggressive forms of skin cancer. But that's not all. Yellowing of the skin, jaundice, might indicate liver cancer, while redness, itchiness, or dimpling could be an early sign of breast cancer. Skin cancers are among the most treatable when caught early. Consider the story of a young woman who noticed a tiny asymmetrical mole on her leg. It turned out to be melanoma, but early detection allowed for successful treatment. Conversely, many people ignore these changes until it's too late. Perform monthly skin checks. Look for any new growths, changes in existing moles, or persistent irritation. Use the ABCDA method to evaluate moles, asymmetry, irregular borders, varied colors, a diameter larger than 6 m, and evolution over time. If anything looks suspicious, consult a dermatologist immediately. Sign 4: persistent cough or hoarseness. A cough is one of the most common symptoms of a cold or allergies. But what happens when it doesn't go away after 3 weeks? Persistent coughing, especially if accompanied by blood or chest pain, could be a warning sign of lung or throat cancer. This symptom is often brushed aside. For instance, non-smokers who develop a chronic cough might assume it's due to allergies or pollution, delaying their diagnosis. But even non-smokers aren't immune to lung cancer. Similarly, hoarseness that doesn't improve could point to throat cancer, especially if it's paired with difficulty swallowing or unexplained weight loss. Keep track of how long your cough lasts. If it persists beyond 3 weeks or worsens over time, consult your doctor. A simple chest X-ray or throat examination can rule out serious conditions. Sign 5. Unusual bleeding or discharge. Blood in unexpected places is always a cause for concern. Whether it's blood in your stool, urine, or during coughing, it can be an early sign of cancer. Colorectal cancer, for instance, often starts with small amounts of blood in the stool, while bladder cancer might present as blood in the urine. Women might notice spotting between periods or after menopause, which could indicate cervical or uterine cancer. These symptoms occur because cancer often damages nearby tissues or blood vessels, leading to abnormal bleeding. While other conditions can also cause these symptoms, they should never be ignored. Document any unusual bleeding or discharge. Note the frequency, amount, and accompanying symptoms. Schedule a consultation if the issue persists or recurs, as early testing can often pinpoint the cause. Sign 6. Lumps or swelling. Finding a lump is one of the most recognizable cancer warning signs. However, not all lumps are cancerous. The key is to monitor their characteristics. Cancerous lumps are typically firm, painless, and grow over time. Breast cancer, for instance, is often discovered through a lump felt during a self-exam. Swollen lymph nodes in the neck, armpits, or groin could indicate lymphoma or other cancers. Even lumps in less obvious areas, like the testicles or under the jaw, warrant attention. Real-life examples show that many patients initially dismiss lumps as harmless cysts, only seeking help when the lump grows larger or becomes painful. Perform regular self-checks in areas prone to cancerous lumps. If you find a lump that doesn't go away within 2 weeks or continues to grow, consult a healthcare provider immediately. Sign 7. Chronic pain in one spot. Pain is the body's way of signaling that something is wrong. But chronic pain, especially in one specific area, can sometimes point to cancer. For example, persistent back pain could indicate ovarian or spinal cancer, while abdominal pain might signal colorectal or pancreatic cancer. What sets cancer-related pain apart is its persistence. Unlike muscle strains or minor injuries, this pain doesn't go away with rest or over-the-counter medication. For instance, a patient with ovarian cancer reported months of mild pelvic pain that gradually worsened, ultimately leading to her diagnosis. Keep a pain journal, noting its location, intensity, and frequency. If the pain lasts longer than 6 weeks or progressively worsens, seek medical advice. Imaging tests can often reveal underlying causes. Sign 8. Digestive problem. Digestive issues are common, but when they persist, they might indicate something serious. Difficulty swallowing, chronic indigestion, or bloating that doesn't go away could signal cancers of the stomach, esophagus, or ovaries. Feeling full after eating only a small amount, early satiety, is another symptom linked to these cancers. These signs are often dismissed as minor issues, but they can escalate quickly. For example, a man with esophageal cancer reported years of mild indigestion before finally seeking help when swallowing became painful. Unfortunately, by then, the cancer had progressed significantly. Pay attention to persistent digestive symptoms, especially if they're accompanied by weight loss or fatigue. Don't hesitate to request an endoscopy or other diagnostic tests if your symptoms don't improve after dietary changes.